Changes from the federal government are shaking up vaccine recommendations for children.
WDRB's Dalton Godby tells us all health experts are not on board with delaying or eliminating some of the shots for kids.
The Centers for Disease Control and Prevention is cutting the number of vaccines that are universally recommended to all children from 17 to 11, removing recommendations for shots like flu, RSV, hepatitis A and B, or rotavirus. The CDC now says those vaccines should be given only to children at higher risk or after a conversation between parents and doctors. Vaccines still recommended include measles, mumps and rubella, polio, chickenpox, and others.
For our practice right now, there haven't been really any changes.
Dr. Heather Felton, a pediatrician with Norton Children's, says Norton is following the vaccine schedule laid out by the American Academy of Pediatrics. U of L Health confirmed it is also following the same schedule, which means they're still recommending the same shots.
We still carry all of the same vaccines in our office, and we're still giving them out to patients.
But there are concerns about the long-term impact of pulling back recommendations, especially as Kentucky sees high flu activity and rising measles cases nationwide.
Delaying vaccines does put children at risk because the way that the schedule has been set up is to protect children from diseases when they are most at risk for those specific diseases. And so waiting at all does leave them vulnerable.
Dr. Felton says the key right now is communication, not confusion. Local pediatricians say parents with questions should talk directly with their child's doctor before making any decisions about delaying or skipping vaccines.
I've used this entire schedule throughout my entire career and have vaccinated probably tens of thousands of children who have done really well with those vaccines, and I've seen very little of these vaccine preventable illnesses because of the schedule that we have been using.
Dalton Godby, WDRB News.